Let's go to the next. So may I introduce David? David is the founding president of Alliance for PTSD Recovery and PTSD Relief. They are international charities that help 100,000 people to heal from trauma from across the world, so Africa, Middle East, Europe, and Asia. He co-authored 3 scientific studies showing Transcendental Meditation can reduce PTSD and hundreds of articles on trauma recovery. Today, this alliance continues to support the education, training, and research efforts in more than 10 countries worldwide. So without further ado, I would like to present to you David. So David, can you take away from here?
Thank you very much, Joanne. I've really enjoyed your presentation, this beautiful video on Bobby Roth and the pranayama lesson, and also Dr. Ani's beautiful review of her 7-step integrative healing. Today we're just going to talk about one tiny little area where TM is Transcendental Meditation, or TM, is very effective. I'll tell you a quick story on why I'm doing, before we get into that, why I'm actually focusing on PTSD, post-traumatic stress disorder, or trauma, is that 2011, I was invited to do a research study on Congolese war refugees. And I said, let's see how effective or transcendental meditation would be on post-traumatic stress disorder, which is, of course, is severe long-term trauma. And I said, well, let's see what happens. So we got some top scientists together. We got a group of Congolese war refugees that had very, very high levels of PTSD. And we divided them into 2 groups. One of them was going to learn TM after the study, after 4 months, and one was going to learn transcendental meditation right at the beginning. So they were identical. They had very severe levels of PTSD. So we taught the group that was going to learn TM, and then after 1 month, we measured them again. And the group that had not learned TM, they were slightly worse because they were refugees out of their country. They didn't speak the language. They were really suffering. The group that learned TM, every single person, this is using standard testing that's used all around the world, self-testing. Every single one of them was actually out of PTSD in 30 days. I was completely surprised. I had no idea. I thought it'll have a little improvement, but it wasn't a little improvement. It was a huge improvement. So we tested it again, and we found the same result for that type of population. Later on, different populations have different for different groups, but that group of Congolese war refugees had marvelous results. So I said, okay, well, then this is something I should use to help people all over the world with trauma. So that's how this thing started, by finding out firsthand that there was a tool that was extremely effective at reducing post-traumatic stress disorder. Do you want to go to the next slide? That's the next one. I think we need. Okay, so what we're going to do, what I'm going to do today is just first go a little bit into the science. There are 25 scientific studies now just on transcendental meditation and reducing post-traumatic stress disorder. There are actually over 500 studies on post-traumatic stress disorder, 500 studies on transcendental meditation on a very, very wide range of mental, physical, behavioral, and even sociological changes that are all positive. But we're just focusing on this one area of PTS, post-traumatic stress disorder. Now, I know that a number of you are probably psychologists. So this is going to be a real repeat for you. The reason I'm bringing this up is that I was told that a number of the people here are victims of trauma. And I just wanted, this is for their sake, I'll just review a few of the 20 symptoms that are now main symptoms that are considered. When one's been through a horrible traumatizing experience, you can have those horrible memories come back over and over again. And from that, one can start to withdraw and start avoiding those type of events. One can feel emotionally numb, and then one can have trouble sleeping. One can be overly alert or hypervigilant, and then one can start getting angry, a lot of anger issues, and Dr. Ani certainly mentioned the danger of anger and destructive behaviors like excessive drinking or using drugs, excessively use of, use of non-prescribed drugs, and so forth. Go ahead. So what makes this is a section I just want to talk a little about how TM can be helpful. The first point here is that TM, Transcendental Meditation, works really with everything. You can do it with, you can have counseling, you can do exercises, you can you can do forest walks, you can walk in nature, whatever's beneficial to you, you can do, and TM will support because it's bringing you a very deep level of rest, which releases stress, and that stress, you're more receptive to doing all the good things in your life. As I said recently, another point is that for post-traumatic stress disorder, all the 20 or 25 studies show that there's statistically a large improvement. That's a very big thing. It's not like some of the studies show a medium improvement or a small improvement. All the scientific studies show at least a large improvement and sometimes an extremely large improvement with TM, and often in 30 days. So while you're doing these other things, you're quickly getting relief, very, very quick relief. And if you do this twice a day, Transcendental Meditation twice a day, you'll maintain your progress and continue progressing more and more each day. Most of the studies show that even that within 1 month of practicing Transcendental Meditation, there's a very big reduction. I said I was completely surprised that this group of Congolese war refugees we started with, all of them were out of severe PTSD in 30 days. That's not standard, but for that group, that's what we found. There's been what's called a meta-analysis. We're still on the other slide, the other part of that. There's been what's called a meta-analysis, which means it's a large testing of all the meditations that have been scientifically studied to reduce PTSD. That includes mindfulness-based stress reduction, includes other mindfulness techniques. It includes all the other meditations, and includes Transcendental Meditation, done just using their own research papers. And TM was, this is a recent paper that came out called a meta-analysis. It showed that TM was honestly twice as effective, almost twice as effective statistically in terms of facts compared to other meditation programs for PTSD recovery. We laud everything that's good, but if you really want to make sure you have the best chance of coming out of PTSD, we have to be honest and say, this is the most effective meditation for reducing PTSD. You can go slower, and maybe you'll have beautiful results. This is for the large groups of people, it's the most effective. And on an individual basis, anything can happen. This is just what the comprehensive meta-analysis showed on TM versus other meditations. There are over 10 million people who have learned TM around the world, and it's all taught the same uniformly taught the same way by everyone around the world. As Bobby Ross said in the Mosin video, it's easy, it's effortless and enjoyable and even blissful practice. It's a great joy to practice TM. Can you move to the next half of that slide? The other thing that's extremely important is that for people some people are very, very sensitive to remembering the traumatic events they've been through. If there's been a horrible hurricane, a typhoon, or an earthquake, or some family member is hurting you, or some other really traumatic events, some people are very sensitive to remembering those things. TM has a very special value that it's called non-trauma facing, which means you don't have to, it's not part of the program to think about what was bothering you before, what the causes of the trauma or the symptoms. It's not part of TM. TM just you settle the quieter, more happy, more peaceful levels, and then the stress is released in that process, and you come out more fresh, more clear, and more open to creating a better life. So for many people are comfortable remembering those events, and that's fine. But people who are sensitive to or resistant or uncomfortable facing the memory of the trauma, TM does not require that. So that fills in a gap for people who simply aren't comfortable with that kind of procedure. As I said before, there's a one factor in for people with post-traumatic stress disorder is how do you come back and live? How do you grow from that experience? How do you become more happy, more successful, more effective at your work? How do you get along better with people? Well, Transcendental Meditation has a huge range of benefits. So part of it is it's very broad spectrum for producing post-traumatic growth. It helps you from day one in not only overcoming the traumatic experiences, but living a happier, more successful, more fruitful life. Another point which we're gonna look at a few little charts to show these points, but a very important point is that when compared with other treatments, it's extremely rapid compared to prolonged exposure and group therapy and so forth. It's faster. So, if you want to do it with those other procedures, it's perfectly fine, but this will give you support to an initial improvement, rapid improvement that'll support the other procedures as well. As I said, it can be done by itself as a standalone, or it's very good with other. It gives support to the healing process through other procedures. And also, it can be some procedures. It's less expensive than prolonged exposure, for example, in many cases. So this is another study that was done by the military in the Journal of American Medical Association, which is one of the top journals in the United States. They did a study in 2015, also called a meta-analysis, which means it looks at all the people who did the most recommended treatments, which are prolonged exposure and cognitive behavior therapies. And they said how many of those people actually came out of PTSD. No matter how long they did it, how many people came out of PTSD? And the answer was that 1/3 came out of PTSD. So this is just it's important to see this. It means that it's effective, but there's something more is needed to support the treatment so that more people can come out. Something is needed to supplement prolonged exposure and cognitive behavior therapies. So TM is a very powerful tool to rapidly help and then provide support for the person, so those other 2/3 that aren't coming out have a better chance of coming out of PTSD. Next slide, please. This is the point I made earlier. Do you see there's a line at the number 10 goes across. At number 10 is a clinically significant reduction in PTSD. And there's another similar chart for effect size showing how effective it is. This one shows that in every single study, the drop in PTSD was greater than the line where it says 10. So basically, if it's below 10, then that means that that group had a clinically significant reduction in PTSD. Every single group, whether it's a person who's a soldier or a prisoner or a refugee or a student with PTSD, every single group with TM has a clinically significant reduction in PTSD. Next slide, please. And this is that point about this is that point comparing mindfulness-based stress reduction, MBSR, MBO, mindfulness, other mindfulness-based meditations. You're actually covering, okay, here we go. OM means all the other meditations, and TM is Transcendental Meditation. And you can see the drop here. This is statistics. I'm giving you a little quick lesson in statistics so you really see this is very large number of people have been tested here using different techniques. The drop in, if it's below 8, then that means it's a large reduction in PTSD. So you can see that all the other 3, 6, 9 other groups who were tested, the other mindfulness-based treatments, one of them, which was for civilians, showed a large improvement, and the other ones were 4 to 6 is a moderate level of improvement. So they had improvements, which is true, but not really a large improvements. With Transcendental Meditation, the yellow is the red is military, the green is civilian, and the yellow is combined. With Transcendental Meditation, they're way more effective, much bigger drop than 8 or even 1. It's almost 1.1. It's a huge drop, very large drop in symptoms with PTSD through TM. So it's good to be. So that's an important, that's the review of this big important study. Here's just another study which we brought out the same point too in terms of speed. The faster the drop, this TM is the dotted line. This is how quickly the symptoms are going down with TM in each case. In every case, you can see whatever they're comparing it with, TM was the fastest. So it's good. If you're getting that person out of that horrible situation, helping them get out faster. Next, please. Next slide, please. So now, TM is good in all kinds of, if you want to categorize PTSD or trauma, you can say, what's the cause of it? Can it be typhoons and volcanoes, military combat, domestic abuse and sexual abuse, terrorism, war, violence, automobile accidents, anything, or a person has had a violent life and they become, and they themselves are, anyway, so there could be many, many causes. TM is effective at all. Let's go on from there. So TM is actually broad spectrum. And in 1989 in Armenia, and Dr. Ani will remember this period, there was a huge earthquake that some very large number, that said here, 10% of the population was killed in Armenia. And a group of I think 8 or 10 TM teachers went, and they taught 30,000 people in 1 or 1.5 years. And they had a very large drop and people had wonderful improvements. There are women the wailing women in Leninakan, now Gyumri, which is a fairly large city in Armenia. They were crying from the great grief of the whole situation. They couldn't stop crying. And after they learned TM, within a few days, they were smiling and laughing again. So it's a beautiful, beautiful situation. In Congo, we're teaching. This is a war situation for civilians. This is what one man said: when you live in a war zone, you can get woken up in the morning with crackling sounds of bullets, stress, headaches, trauma. That is everyday life here. TM has helped me psychologically, and I no longer have headaches. Next slide, please. This is a woman who the terrorists came to her in Democratic Republic of Congo, killed her husband. She was raped, and she said, there was so much pain. I was sick all the time, typhoid, malaria. It was an impossible situation for 3 years. After learning TM, my hearing is back. I can sleep again. Now I'm functioning normally again. So this is within a few weeks, a month of learning TM. So TM, as we said, is very, very broad spectrum support, but this is one study that showed that along with PTSD, there were reductions in insomnia, depression, and anxiety, which are all actually components of or parts of or go along with PTSD. Go next, please. This is what a military man, a soldier said who was in the war. He said in 2009, I got deployed to Afghanistan. It was hard for me to ever wind down or get some sleep or get some rest. First week I was there, 3 soldiers got killed. I thought, I'm not going to make it home. I started thinking about suicide. When I got home to the United States, my problems continued. I tried individual counseling. I tried 5 or 6 kinds of depression medicine. When I learned Transcendental Meditation, for the first time, and I don't know how long, I felt hope. I had tried so many things that had not worked for me. This is the first thing to get suicide off my mind. TM is about giving you a better quality of life, and you feel better in every aspect of what you are doing. So we're just touching on different groups. This is a lady who had a lot of domestic abuse. This is South Africa, a university student. I have dealt with bigger problems like forgiving. Could you go back, please? Like forgiving my grandfather for the beatings. With TM, finally, I found a happier me with a big sense of humor and love. So she was transformed. She got over that huge stress from her horrible behavior of her family, domestic abuse, and now she's happy again. Next. So do you want to show this? We can show
or maybe
let's ask, are there any questions now from anyone?
Yeah.
Let's ask any questions from anyone. We're glad to try to answer. I've been done programs all across Africa, Middle East, Asia. We're now, of course, helping out in Philippines the best we can. And we can set up programs to help with large groups of people. We can teach very quickly to give a quick support to start reducing the stress and bring inner peace. So any questions from anyone?